Joining me this morning from ACMC, Ashtabula County Medical Center, is Dr. Nate Franley. Welcome, Nate. This is your first time.
It is.
This is the first time. And tell us a little bit about yourself.
Well, thanks for having me, first of all. I grew up in Jefferson, so I do family and sports medicine, a practice in the Jefferson office. Went to medical school, University of Toledo, undergraduate at John Carroll, and I did my training at Fairview Hospital and the Cleveland Clinic.
Oh, okay. So how long have you been doing family medicine?
Family medicine, I finished my residency a little over about a year ago. And then I did the sports medicine fellowship, which is a year-long fellowship.
Now, Dr. Rufa used to do this for, I believe, our Spartans. He might have done it for other teams too, but for our Spartans, I think he donated his time for that. And then when I announced him the last time one of the ACMC staff members were here, they said, no, Dr. Franley has taken over that, so you're doing that. Do you have to go to the games and all that stuff?
Yeah, I do go to the home games for Conneaut, and I also, on Tuesday afternoons, I'll go out to see the athletes at the school. So it's kind of another thing that we do just to help out the athletes.
Sure. Do you see, in this day and age of concussions, do you see a lot of that still happening out there?
Absolutely.
Yeah.
Absolutely. It's huge, especially in football. So yeah, that's one of the big things that we focus on.
I know they've tried to update the helmets and all that stuff, but there was just, the Browns had a scrimmage here, I believe it was last week, and one of their running backs got nailed. It was terrible to see. I mean, you knew he had to have some kind of concussion problem, and sure enough he did, and he's been out for 2 weeks or something like that. Could be out much longer. Nothing to fool around with, right?
No, not at all. And if you don't get immediate treatment or make sure you get the appropriate treatment up front, then the symptoms of a concussion can last longer. So what could be a 7 or 10 day injury could end up being a 2-3 week or 2 month injury.
No kidding.
So we really try and get to the athletes quickly.
Doctor, when you see a player get hit, especially on the head, say you're watching a game here, do you immediately say, this guy's got to be assessed right now?
Definitely.
You don't wait for the coach to call you in?
No. We definitely tense up when we see somebody take a hard hit and watch them walk off the field or make sure they get up. And we'll watch them for at least a couple minutes to make sure they're not wobbling or dizzy or confused. And then we definitely do assess everybody who takes those hard hits.
Yeah. And obviously they have to follow what you say before you can release them to play.
They do. We're kind of the gateway to make sure that they're safe to go back on the field.
Now, this guy that got Duke Johnson's his name for the Browns, he got right up. Of course, he's a young kid and he's trying to impress the coaches, but he did not look at first like he had a concussion situation. However, when he was on the sidelines, there was a little wobbling going on, so it must have took a while for it to surface.
And that's interesting. I mean, a lot of times adrenaline does play a role in it.
Does it?
So we'll have folks that we have to actually pull out for a couple minutes, and then they start to notice, you know what, I do have a headache, or I guess I do notice I have a little bit of neck pain. So there's definitely that element of it.
Is headaches quite common then with that?
It is. I would say I think it's the most common symptom of a concussion.
Yeah, I see. I've never, knock on wood, had a concussion, but very, very prevalent in football injuries, as doctor said, and something I've been really watching, especially in the NFL now, the last few years anyway.
Yeah, they even have an athletic trainer that serves as a spotter for every NFL game, so they'll just watch the game.
Yeah, that's right.
And if they see anything suspicious, they'll relay down to the coaches or the medical staff.
What about some of the other injuries in sports that you had to tend to? Broken limbs or anything?
Yeah, some broken limbs. We've had some finger dislocations, shoulder dislocations, elbow dislocations, ligament sprains, MCL, ACL, all those types of things. So we can assess on the field, and I think that's the nice thing about having a doctor there, is we can decide if it's appropriate to have somebody go back in to play, if there's a brace we can give them to play, or if they need to be held out for the rest of the game.
I just looked at my notes here. I didn't realize you also do St. John's.
I do.
Okay. So you're pretty busy, huh?
I would, yeah. Well, the last couple games St. John has played on Friday, along with Conneaut, so I had to pick one.
Oh, I wonder how that works. Yeah.
Soon we'll have Friday and Saturday, so I'll do Conneaut Friday and St. John Saturday.
Gotcha. Because you're a hometown guy in Jefferson, is that what brought you back here to
It is. I always wanted to come back.
Mm-hmm.
I didn't think my wife would ever want to, but when she said...
Is she from Jefferson also?
She grew up in Willard, Ohio.
Okay.
Small town in Ohio, south of Sandusky. But she one day said, I want to come back to Jefferson, and that was an easy decision for me.
You have any kids or anything?
Not yet.
Not yet?
Nope, she's in physician assistant school.
Oh. Yeah.
So I think once she's done with that, we're going to hopefully start to try to start a family.
Before I forget, and I've done this in the past, forgot to ask your phone number, where you're actually located, that sort of stuff, if anybody wants to get a hold of you for.
Absolutely. I work physically in the Jefferson office, which is on 234 North Chestnut.
Mm-hmm.
The phone number for the office is 440-576-8933. And you can call, make an appointment through that scheduling line.
It's 576-8933.
8933.
Okay, very good. Now, of course, with family practice, everybody should have a doctor, and everybody should be checked out at least once a year anyway with a physical. And do you have a routine that you watch for when you have people come in? Of course, you probably take all patients of all ages.
Absolutely.
Yeah. Okay. Say if someone comes to you and is asking for a regular physical, what would that entail, Nate?
Yeah, so I think your point is good depending on the age, but definitely would do an exam. And the things we would talk about, a lot of screening items. So for males over 50 or females over 50, we talk about colonoscopies. We would discuss whether or not it's appropriate to do prostate cancer screening. And I do tailor it to the patient as well. So if there happens to be a family history of skin cancer or a personal history of skin cancer, we would tailor our exam and our history to those types of things. And of course we deal with any sort of acute issue or things that the patient wants to talk about at that visit too. So we'll deal with any issue mostly.
I've had a lot of doctors on the show over the years, and one of the things that they always stress was to make sure that your blood pressure is under control.
Absolutely.
And because that leads to other problems if you don't have it under control. So obviously that's probably one of the things you look at very closely as well.
Absolutely.
Yeah.
And we'll screen for diabetes, make sure
Diabetes, yeah.
That's another huge one.
Mm-hmm.
And I like to talk about diet and exercise as well, especially on that first visit.
Yeah, please do, because if you could explain it here, I think all doctors are really concerned about the lack of exercise in America today, and
Yes.
the diet, the fast foods and all that stuff, which is not good for you.
Right. I mean, the simple things that I tell people would be for especially lunch and dinner, if you can make half of your meal a green vegetable, whether it be a salad, a broccoli, that's one easy thing that you can try and do from a diet standpoint.
Mm-hmm.
As far as exercise, they recommend 150 minutes a week.
Which would be how much now?
That could be walking, that could be half hour a day, 5 days a week. Doesn't have to be going out and running a marathon, so I tell people to start slow. And you might want to work up to that 150 minutes. So biking, walking, elliptical, anything you can do just to stay active is important.
I had a doctor tell me that he goes, it's really easy to do that 30 minutes. He goes, take the dog for 15 minutes one way and then come back the 15. You got your 30 minutes in, and the dog's happy and you're happy, and it just works out.
Absolutely.
That exercise is important. Treadmills.
Yes.
Do you prescribe to that?
Yeah, I think they're good. I think running on treadmills can be a little different than running on road. So if you're used to running on the road, the treadmill will be a little bit different for you as far as impact. But yeah, I'm a big proponent of treadmill.
How do you get people to stay up with a treadmill? A lot of people say it's so boring, and they do it for like 3 or 4 times and then they don't want to do it anymore.
Right.
what would you suggest that they would do?
I would say if you do get really bored on the treadmill, then you can try and mix it up with other things like biking. Some people put a TV up in front of the treadmill.
Mm-hmm.
I myself do get bored on a treadmill, so I like to preferentially run or walk outside.
Mm-hmm.
Things that I also cross country ski.
You do?
So if you're
So you
interested
practice
in-
what you preach.
I try to. But if somebody wants to just be outside, then I think we in this county especially we have some great options.
Mm-hmm. Mm-hmm.
So cross country skiing on the trail, they groom the Greenway Trail.
Yeah, yeah. Mm-hmm.
So it's a really nice place to go. And
Nate, you mentioned diet, and you're a thin guy. It looks like you're in pretty good shape here. What do you suggest for people out there? Stay away from too much red meat.
I think it's really hard to tell somebody to completely stop eating red meat.
Mm-hmm.
I think in moderation is probably the way to think about it. So, and that's where if 75% of your meal is a red meat, then maybe just kind of modifying your portions to make more of your meal a salad or say green beans or broccoli,
Right.
just to mix in some healthier items. Some people can limit their red meat to once or twice a week. You can add more fish, add more chicken, pork, white meats to your diet. But I think I don't know that it's horribly bad to have a portion or two of red meat a week.
So pork is not considered a red meat.
I believe it's a white meat.
It is white because
Yeah.
we just had some chops the other night.
Yeah.
Now what we do, and I've done this since I was a little kid because my dad did it. But on Saturday night we have a steak usually, but not a big thing. Usually it's small enough where I might only eat half of it. So we don't eat a lot of red meat. Tried to go through chicken and fish, and that seems to work. At one point I did give up, Nate, sugar, and I couldn't believe it. In like 3 months I lost 65 pounds. I couldn't believe how fattening sugar is.
Absolutely.
Yeah,
I mean, I see there's a lot of people who drink 2 or 3 cans of pop a day.
terrible.
As soon as they cut the pop out, in a month they lose 15 or 20 pounds.
Yes, that happened to me.
Yeah,
I went to water, and I do miss a can of pop, but I didn't realize one of the nurses told me, that sugar is sin, is their exact words. And when I cut that out, I lost, and
Absolutely.
it showed,
We see that a lot.
Yeah.
And same thing, some people will stop drinking pop but then go to, orange juice or apple juice, and the juice still has a lot of sugar in
Yes, it does.
So, and the same thing with coffee. If you drink a lot of coffee, watch your sugar and cream in your coffee too.
Mm-hmm. Do you prescribe to your dieting there with the no red meat and all that stuff?
The red meat, no, I don't. I still,
At least you're on
do
it.
eat red meat, but I do try and eat fish and chicken throughout the week,
Mm-hmm.
and I do try and eat as many vegetables as I can, especially with lunch and dinner.
Right.
Dinner more so than lunch, I find is easier for me to get my vegetables in. Ideally, I would eat fruit in the morning for breakfast and eggs to get some protein.
Mm-hmm.
And that would be another thing I would say is a lot of people don't realize the power of protein. It kind of fills you up and prevents those food cravings through the day.
Yeah.
So something like yogurt, peanut butter with celery or carrots can be a pretty good snack too.
Sure. Sure.
So I do my best, but I think we all have our vices, and I love ice cream.
I do too. That's my downfall. Yeah, and a lot of people have a bad habit of eating. I've seen people eat bags of potato chips like nonstop.
Yeah.
That's terrible for you.
Right.
That kind of stuff.
Right.
And so if you do go to the snack, like Nate said, the celery and things like that, and I like salads. I really like salads a lot. Go to that. It's much more healthier for you. Not that I'm the greatest health fanatic in the world, but certainly when you get my age, you start having to watch things. So, yeah, and I did just see on my notes here as well on the sports medicine end. And I'm not sure about this. You maybe explain it. High-end casting, splinting, and bracing. do they still, is that high-end casting? What's that?
We have regular casting, which is fiberglass casting. We also have two different types of waterproof casting. One is called an exos cast that we actually mold in a kind of an oven, a conventional oven, and it gets to about 300 degrees, and so the cast or brace molds to your wrist or whatever body part we're going to cast. And that can serve as a cast or a brace, but it is waterproof, so it's nice for kids. And the other option we have is a way to make the fiberglass cast waterproof as well. So we'll do that for some of our football players, or in the summer if we have a kid who really wants to swim, then we still have that option available.
I've had broken bones in the past, but they were quite a while ago, and I don't know if things have changed. The casting I used to have is where they you know what I mean?
They wrap.
Yeah, with
hardens
the hard
after.
thing. Yeah.
Yeah.
Do they still do that?
That's, yeah, exactly. We still do that.
That's the same
and
thing
it's-
as hard end.
Right. The only difference if we're going to do a waterproof, and that's the fiberglass that you wrap,
Okay.
but the only difference would be that the padding underneath it would be waterproof instead of a soft material that would have trouble if it gets wet. We use it's kind of like a bubble wrap almost that just beads the water off.
I noticed a lot of things too, Doc, is like with broken feet or ankles, they have the boots that they have
Yeah.
too.
Yeah.
Do those
They're great, and they make it easy on us too.
Yeah, I bet.
Just to put a boot on rather than have to cast everybody.
do you leave that on 24/7?
Depends on the injury. That's a good question. There are some injuries that we can allow people to sleep in the boot. Sometimes, depending on their level of pain or the type of injury, we can allow them to walk out of the boot just to use the restroom.
Right.
But there are injuries where I do tell people you have to leave that boot on 24 hours a day, 7 days a week.
Yeah. My son broke his toe at work here a couple months ago. Didn't like a lot of guys, did not follow up on the medical end of it when he should have. It's taken forever for that toe to heal. You know, it just and it may have even healed wrong. You know, seeing a podiatrist with you now, but with ACMC, but. Probably you get hurt like that, you should go to a doctor and have this kind of stuff checked out.
Yeah.
You know, and I've tried to tell him that, he wouldn't listen to me, but.
That's one of the nice things about our office too, I should say, is we do have casting X-ray in office.
Oh, it's
So
right in your
you can-
office?
Yeah.
Oh, cool.
We have lab now too, so you can have kind of a one-stop shop. We can do everything in that visit. Get the X-ray, come back and see me. We can decide if we need to put a boot or do a cast or a brace. We have crutches that we can give people.
Right.
So we have all of that right in our office, which makes it easier on people.
Well, you know, especially elderly folks, they like that one shop stop, you know, and not have to drive all the way to Cleveland and back and all that sort of stuff. If they can get it done locally, that's what is more convenient for them. More
Absolutely.
for them. You also had said to here, you have tools for concussion management as well as neurophysiological testing for high school athletes.
Yes.
Yeah,
the majority of our sports for the schools that we cover, which would be Conneaut, Lakeside, Edgewood, and St. John, our athletic trainers we have what's called the impact test, which assesses your neuropsychiatric function, which is essentially your cognitive function. We do that at baseline, so before the season starts. That way, if somebody does have an injury, we have a test to compare.
Oh, really?
Based on how their recovery is going.
And how does that work? Is that, do you have to get in some kind of machine or something?
It's a computer test.
Computer test.
So the athlete will sit at the computer and take the test.
I see. Let's take this call if you don't mind.
Sure, absolutely.
Hi, you're on the air.
I've got two questions for Dr. Franley.
Sure.
One, do you see significantly different injuries in female athletes than you do in male athletes? And how do you feel about the really young kids playing full contact sports, like in second grade, third grade, and even younger? And I'll hang up and listen.
Very good questions. Thank you.
So the first question, different types of injuries in females. I think in general there are some, such as female athlete triad, that we definitely watch for in females. The female athlete triad is interesting. we've had a couple people who don't realize that it's not normal to not have a period for more than 3 months. And that can come from just not having enough calories. In some of the sports where it's more focused to make sure that women are thin, such as volleyball or cheerleading, you really have to make sure that they're not overdoing it, because it can start to affect their bones and can start to affect their menstrual cycles. So that's one big thing that we don't see in males. But some of the things like ACL injuries, it's a different type of injury in a female, and there are some ways that we notice with female mechanics that are a little bit different.
Mm-hmm.
So I would say sometimes it's just we see different injuries more often in females than we do in males.
Okay.
And the second question was in regards to...
Contact sports for the young ones.
That's an interesting question.
It is.
And so some of the things that recently have been brought up in discussion of literature is, is the younger athlete, say football for example, are their neck muscles strong enough to support the helmet? Because you see some of these kids can barely even hold up the helmet. So you would think that when they hit the ground or when they fall, they might not even have to hit the ground, but their head would jostle back and forth more just because they don't have that strong neck muscle support.
Mm-hmm.
And that's a question that I think about for myself too when we do have kids. I don't know that I'm going to say you can't play football when you're in 6th, 7th, 8th grade. And I'm not sure yet if it'd be my preference that they didn't.
Mm-hmm.
And it's interesting for me too because I didn't play football until I was a sophomore. So I think, if I had played when I was younger, I might have more experience and I might have been a better football player. But then there is also this fine line between making sure you don't overdo it and you do want your kids to be safe. So I think there's somewhere in there's a balance. And I'm not sure if that balance is 7th grade football. Football's a tough one, but for other sports, the big thing is just making sure that they're not overdoing it. And I think it's really important for families who can spend their whole summer driving their kids back and forth to sports. And,
Yeah.
I think a lot of us see that too, where the family structure is completely lost.
Too, Nate, with computers now, it's a lot of kids are not getting outside and exercising like we did when we were younger. Playing sandlot baseball and football and all that sort of stuff. And it is a fine line because you've got a kid that maybe wants to play football and you're saying, well, no, it's dangerous, you shouldn't, it's a hard thing to call,
It is.
And I haven't had to
It
put
is.
up with that forever, because since his 40s now, early 40s, but it is hard.
And the other thing that's interesting that I want to mention too is a lot of kids are playing, say they play baseball or softball, they're doing a lot of the travel leagues at really young ages.
Mm-hmm.
And I want to address that because there's actually really good studies out there that show that if a kid focuses on one sport at a very young age, it actually takes away from their overall athleticism or ability to be at a higher level in other sports. So if you really want to do the best thing for your kids, I'd say let them play a variety of sports
Really?
at a really young age.
Mm-hmm.
And don't necessarily focus on one thing.
Mm-hmm.
I think there are some sports where it is important that you have to start at a really early age,
Right.
such as gymnastics. But in general, I think it helps kids develop a lot of other things like coordination if they play multiple sports.
One of the last things I wanted to ask you about, and see, I'm not up to date on a lot of this stuff. But it says that you have a cutting-edge ultrasound machine to aid in diagnosis. And when I was a kid, I had a planner's wart, and it seemed to me they used ultrasound. This is probably something. This was 100 years ago. They were using ultrasound. They put an oil on the bottom of your foot and ran this ultrasound thing over and over on it, dried it up after so many weeks, and then it fell off or something. But that's a completely different ultrasound, right?
It would be. It would.
I don't even know if they do that anymore.
I haven't yet.
It's outdated.
But yeah, the ultrasound that we have, I use mostly for injections in the office. I can do hip joint injections for arthritis.
Mm-hmm.
I can also diagnose tendon injuries such as rotator cuff. And if there are specific injuries such as the rotator cuff or hip gluteal tendon injuries, then I can actually inject or at least diagnose with the ultrasound.
It seems like my mom had stenosis of the spine. She's since had surgery, but prior to that she would, and I think she still might even get shot. There's a shot that she has to get every so often that apparently numbs that pain that she has. And,
Yeah, so you can do those. A lot of those are done through pain management.
okay.
Those injections are tough ones to learn, and that was not a part of my fellowship to do.
Mm-hmm.
More the epidural and some of those types of injections.
Right, right.
But we do some injections for the back. Sometimes the sciatic nerve gets pinched under some muscles in your buttock region.
Mm-hmm.
So sometimes I can go in and inject some of the muscles that would impinge upon the sciatic nerve.
Yeah.
And
Yeah.
sometimes for SI joint arthritis, which is in the back, the low back, I can inject that joint if people do have.
And that relieves some of that.
It would.
pain.
And if it doesn't, at least it would tell us, maybe your pain isn't coming just from the SI joint.
Mm-hmm.
So it might help us clue in on maybe there's a bigger picture thing going on.
How many years do you have to go to school to be a doctor?
If you include undergrad, the school is 8,
Mm.
and then the training is at least 3. So you
Is
have-
that the internship type
yeah,
stuff?
the residency.
Residency.
And that's more hands-on learning.
Yeah. Yeah.
So overall, it's at least 11 years.
Wow.
And most people will probably some will do a fellowship, some will even do a residency that's longer. So it might even be 12 or 13-year journey.
Did you always want to be a doctor?
Ever since I was about 16, I knew
Really?
I wanted to be. I had, my grandpa was a physician, he delivered babies, he was a family physician. So-
Would that be Dr. Franley that was here?
It would, yeah, Harold Franley.
Yeah.
So
He
that was my
retired,
grandpa.
right?
He did. He passed away when I was at the end of my high school years.
Is that right?
So, but I got to know him really well, and
Mhm.
he was a big inspiration. So
Okay.
there's a lot of family influences. My dad was a dentist in Jefferson.
Really?
So he was big. My aunt and my uncle were both physicians in internal and family medicine. My uncle, actually, my Uncle Doug, practiced in Conneaut for a
Doug.
time. Doug Franley.
Doug Franley. Boy, see, when I saw the name when you came in this morning, since we were off yesterday, I didn't know how to advance on this. I go, that Franley name it's more prominent than I thought. I didn't realize all those relatives. were
And I
in the
should say
business.
too, my grandpa Lake was the vet on 46 in Jefferson.
Is that right?
So there's a lot of medical influence.
I guess. I've never had a doctor on with that much medical influence in the family. That's fantastic. Well, I want to wish you well. I want to give your phone number out one more time, if you don't mind.
Yeah, absolutely.
Dr. Franley has a family practice in Jefferson, 576-8933. 576-8933. And get a hold of him. He looks like a very, very promising young man coming up in the ranks of the medical field. And I want to wish you well, and your wife as well. So she'll be not a doctor, but a
physician assistant.
physician
So
assistant.
she can write prescriptions and practice medicine
Mm-hmm.
fairly independently as well.
Good.
What she's done. So
Would she be working for you, or?
she said absolutely not.
Sounds like my wife. No way. Well, I want to wish you well. I think you're a very nice young man, and I'm sure you'll do well out there. And take care of our Spartans out there.
Will do. Thanks for having me.